A tube that glows may be the key to detecting a certain cancer.
Medical editor Irene Mayer joins us now from our Tampa newsroom with more.
Dentists have been on the front lines of cancer detection for years, checking the mouth for oral cancer. Now there's a new device that's making this screening more accurate and helping find oral cancer in its earliest stages. Tampa dentist John Redd has been checking all his patients for oral cancer for years. Dentists performing routine exams discover many of the 30,000 cases of oral cancer diagnosed in this country each year. Well, now they have some help from new technology called Visalite, a tiny tube that glows and a small amount of liquid that the patient swishes in the mouth. Instead of just looking with the naked eye for suspicious areas,
just open wide.
With Visalite, problem areas appear white under the glow tube.
Changes, the metabolic rate of the cell changes, and when that occurs with the light will reflect on cells and show those as being different from the adjacent cells, which would be having a normal metabolic rate.
Those at risk for oral cancer include anyone age 40 and older, tobacco users, including smokeless tobacco, and heavy drinkers. But Dr. Redd says 25% of oral cancers occur in people with no risk factors, so it's important to have an oral cancer screening at least once a year, or more often if you're considered at high risk. A Visalite screening helps with the earliest possible detection of oral cancer.
It takes, in essence, the guesswork out of it. If there's an area that is going to be potentially a problem, you'll know it at an early level, and we have a biopsy done. If it's nothing, no big deal. If it is something, you know it very quickly.
Dr. Redd offers all his adult patients the option of a Visalite oral cancer screening. The cost is $65, and he says some insurance companies will cover that cost.